Good morning, students. Today we will try to learn more about autism spectrum disorder, which is called as ASD. What is called as autism spectrum disorder today was previously known as a pervasive developmental disorder. So, what do we mean by pervasive developmental disorder? Why was it called so? Because this all these features of autism spectrum disorder, as we see, it will affect the multiple areas of functioning. Unlike specific developmental disorder where a particular area of functioning will be affected, here in autism spectrum disorder the deficit will be seen in multiple areas. It is pervasive. That is the reason it was called as pervasive developmental disorder before. Basically, the major deficits are seen in socialization and communication among children. So prior to the developmental of DSM-5, before they conceptualized it as a spectrum disorder, each one of it were diagnosed independently, like autistic disorder, Asperger's disorder, childhood disintegrative disorder, Rett's syndrome, and pervasive developmental disorder not otherwise specified. All of these were diagnosed independently, but now we gave a common diagnosis as autism spectrum disorder, in which the features or the conditions of all of it is covered. So coming back to what is ASD, autism spectrum disorder. This is a neurodevelopmental disorder like ADHD, intellectual disability, learning disability. This is also one neurodevelopmental disorder with polygenic heritability. By polygenic heritability, we mean there are multiple genes that are contributing to the development of this condition. It is not because of a single gene. It is multiple genes which are the deficits in those genes which are resulting in this particular condition, which is characterized by impairments in different areas, mainly the social communication. That is one impairment where we see. The other thing that we see, the feature that we see among children having ASD, is a restricted and repetitive pattern of behavior. So this autism spectrum disorder is usually becomes evident by the second year of life. But if it is severe enough, we can notice this in the very first year of the child, where the child finds it lacks eye contact with the mother, do not show any affection towards the mother in the very first year. It can be noticed if it is severe enough. However, if it is very subtle, if it is very mild, it might go unnoticed even for several years later. Usually it gets evident by the second year of life. So approximately what they have seen is 1/3 of the children who have been diagnosed with ASD also have condition like intellectual disability. So when it comes to epidemiology, it has been noted that it is 0.15% of children are diagnosed with autism spectrum disorder in the age range of 1 to 10 years. Interestingly, this diagnosis is found to be higher among children residing in rural areas, but more research is required to know why and what is the reason that it is found more in rural areas. Yeah. When it comes to sex distribution, the prevalence is more often in boys than in girls. But when it comes to girls, girl children who are having autism spectrum disorder, they more often exhibit intellectual disability as well when compared to boys. So now we'll try to understand the diagnostic criteria for this autism spectrum disorder. According to DSM-5, how do we make a diagnosis of ASD? The first criteria that they say is there is a persistent deficit in social communication and social interaction across multiple contexts. This deficit should be seen persistently, not one day the social communication is poor, the other day is fine. It should be seen persistently, and it should be seen across multiple contexts. It should be seen at home, it should be seen in school, it should be seen in other social community as well. Multiple contexts, this deficit should be seen. So what are those persistent deficits seen in social communication? One is deficit in social emotional reciprocity, where the child finds it difficult to initiate a conversation or engage in a conversation, ask, be in a part of conversation where the act of back and forth conversation is required. That will be found to be deficit. Second thing is deficit in non-verbal communicative behaviors. This is very evidently seen among children having ASD, where there will be lack of eye contact, there will be lack of any appropriate body language that is required for a communication, a lack of any gestures. This, they find it difficult to show body language and gestures. They also find it difficult to understand the body language and gestures of others. The third thing is deficits in developing, maintaining and understanding relationship. These children, they find it difficult to maintain the friendship or to make friends, and these children also lack any imaginative play in the sense, children like they play games such as doctor game, teacher game. They find it difficult because they're not able to relate to such roles at all. So these are the deficits that are seen in social communication or social interaction. When it comes to clinical features of the same, we can see, yeah, as we discussed earlier, they find it difficulty in reciprocal social skills or spontaneous non-verbal social interactions. In young children, they may not develop social smile at all, and they be less frequent or poor eye contact. And atypical attachment behavior, this is especially, it can be seen among younger children, where they may not explicitly differentiate between a stranger and a known person. Even if a stranger picks them up, they might not cry, which is expected out of a normal child. And when the mother passes, they might not stretch their hands asking the mother to pick them up. Such attachment behaviors are not seen among children having ASD. So they also have difficulty in showing or developing empathy, which is also understood in the before criteria that we discussed. The another criteria that DSM-5 gives is the restricted and repetitive pattern of behavior, interests or activities. Yeah, one is deficits in social communication and social interaction. The second thing is restricted and repetitive pattern of behavior or interest. What do we mean by that? This repetitive pattern of behavior can be seen in motor movements. They might show a repetitive motor movements like rocking back and forth, or they might show repetitive use of a particular object. They might use a particular car and keep moving that car back and forth. It is a repetitive behavior. Or they might show repetition in their speech. They might be repeating the speech of others or using the same speech again and again, or idiosyncratic phrases. Yeah, so repetition might be seen in motor movements or with the help of some objects or in the speech. Another thing is insistence on sameness. These children are not flexible with the changes in the routines that are made. Even a small change that is made in the arrangement of the furniture, they get disturbed, they get irritated. That is, they insist on the routine to be same. Third is fixated interests that are abnormal in intensity. And fourth is hyper or hyporeactivity to sensory input. These are very evidently seen among children having ASD, where they are extremely sensitive to sensory input. We have seen children having ASD being very particular about turning on the torch and keep playing with the light, or they might listen to the tick sound that comes with the wristwatches. And they're very it can be hyperreactivity or hyporeactivity to sensory input. So as I said, the repetition might be seen in speech. They might use idiosyncratic phrases such as, leg sleeves for the trousers. They might describe milk like white water, and various other stereotyped behavior that we can see is rocking back and forth, flapping their hands, finger tapping. Those things are common